Dr. Jason Scoppa. He's a visiting dignitary from Seattle, Washington. Is it Seattle? From Bellevue. Bellevue. It's very close, very close. He's been doing some very interesting cranial work and working a lot with different TMJ patients, and gratefully he's going to be presenting one now.
So my name is Jason Scoppa. I practice up in Bellevue. Thanks to Charles for helping to put it together. So this is just a case study I did. It's a 28-year-old female with chronic TMJ pain, dysfunction. And she saw me like 3 or 4 weeks after getting into a car accident. So she had TMJ pain for a while, kind of low-grade TMJ pain. And then she got in that car accident and it kind of exacerbated all the symptoms. So treated with SOT and cranial technique. Some etiology on TMJ. I don't want to bore you too much with that. I mean, just like we've been hearing, so many different variables involved, a lot of different signs and symptoms. There's a strong recommendation for conservative care first before kind of moving on to more invasive procedures. Some of the conservative care options listed: self-massage and medication and all those kind of things, which I think we can do better than that. She's a pretty healthy female. She's in good health. She's single. She traveled a lot for her job, but she enjoyed it. So she came in chronic right-sided jaw pain, started 5 years ago, and right knee pain, bilateral neck and shoulder pain. So like I said, it was exacerbated by the car accident. She hadn't seen anybody. She saw like a massage therapist and I think an acupuncturist, before coming in, and it didn't do much for her. This was based on a couple of surveys we did, disability surveys and that kind of thing. So she had TMJ pain 70% of her waking hours, average of 7 out of 10. Transient closed locks. It wasn't all the time. It's just kind of randomly. She would just lock closed, and she would just kind of rub her jaw for a little while, and then she would be able to open again. She had clicking, headaches, dizziness, neck and shoulder tension, and restricted range of motion in her jaw. On the TMD Disability Index, she was sort of 6 out of 40, so not super high, but it was bothering her a little bit. Her pain was her biggest complaint. And this is a really good survey, actually. It's in some of these books. I saw Charles had added it in there, but it's pretty interesting just to get more. It's more of a lifestyle questionnaire. So yeah, some massage. She had dietary changes because her jaw was locking up on her. This is just an example of the locking. Dr. Strozzi just kind of went over that. So this is just pre and post treatment. So a lot of this. So we won't go over all of it, but she had a lot of symptoms, and we were able to do pretty well, except with the neck and shoulder tension was still there. But so it's basic SOT exam, cranial exam, all things you're familiar with. Category 2 protocol. There's some different. I added some other things to that. So I did some muscle testing. And then this is the cranial indicators that showed up. These are the manual muscle tests that showed up positive. So treatment, category 2, pelvic blocking with, I said a lot of these are just a standard category 2 protocol that Dr. Gerardo went over earlier. Cervical stair step, which I think most of you probably know what that is. Just a way to release the cervical spine without manually adjusting. Psoas, pterygoid muscles. This is a technique where you use this cranial sutures to address certain nerve root levels within the spine. So I use that for these muscles, and then spots in the spine, and then an occiput. That's what the indicators for the occiput down here. So I adjusted that intraorally. I did it a little bit differently than I guess the traditional way that's in the book. So I just kind of went over that a little bit here. And this is the slide. I'm sorry? Sure. So we did it on exhalation because that's what tested. Normally it's done with an SB+. Normally you do the correction on an inhalation, but because it tested on exhalation, I performed it on exhalation. And I used a different indicator, a different intraoral point. So this would be the assistant's hand. So the top hand, left hand's on the glabella, compressing. The bottom hand's under the occiput, and it's lifting cephalad. So the assistant is just compressing and pulling back. My thumb would be on this spot, not on the pterygoid, but on the palatine bone. And then my free hand is going in a counterclockwise rotation, compressing the sagittal suture and bringing the left parietal bone into the occiput while the assistant is pulling the occiput into the parietal bone. So we're basically compressing that suture right there. So this is basically the first treatment. After the first treatment, she was still sore. She had some restricted range of motion in her jaw, but the indicators were cleared. So we let her go, and she was feeling a little bit better. And 2 days later, she called, and she was doing great. So it doesn't happen all the time. It's kind of like Dr. Gerardo was saying earlier. I mean, to me, it was just she was just so fired up, sympathetic-wise, from that accident, and it just flared her up. And I think just taking care of the category 2 and just doing a little bit of cranial work, I think it really helped bring her down. She didn't have any big occlusal issues that I could see. She didn't have, she wasn't deflecting or deviating or anything like that. I mean, nothing that would really scream out, this person needs to go see a dentist right away. So in cases like this, I mean, I'll usually treat them a couple of times and see where we can get. And if we can get a pretty good result, then I don't refer them over. But if we're having to treat the same stuff every time, or the category 2 keeps showing up, and then that's when I'll send them to a dentist to help with that. She came back 1 month later. She was traveling and she couldn't get back in, and she was doing pretty good, so I wasn't that bothered by it. But she, her jaw pain, knee pain were gone. She said she just had the neck and the shoulder tension. And then 6 months later, the results stayed. So it's really good. That doesn't always happen like that, but it's nice when it does. That's it.